What are the negative health effects of poor posture? Hi, I'm Dr. Tim St. Onge with Thrive Chiropractic in Branson, Missouri. Research has shown that a loss of or an increase in the normal curves of the spine may increase mortality by up to 15 years. People die 15 years sooner than they should because of abnormal posture. Think about that for just a second. Now, some of the less ominous problems associated with chronic posture may include neck pain, headaches, back pain, herniated spinal discs, heart disease, decreased sex drive, depression, constipation, reflux, and breathing difficulties. A long list, wouldn't you say? So what to do about it? In our office, we start off by doing a computerized evaluation of your posture. We take 2 pictures in order to perform a digital postural evaluation. One picture is taken from the front and the other one from the side. The program that we utilize creates mathematical computations which allow us to have a quantitative analysis of your posture so that we can track improvements as we go along in any kind of care plan that we come up with. So, what should posture look like? Well, ideally, when looking at a person's posture from the side, the ankle, hip, shoulder, and the hole in your ear all line up. The most common postural problem occurs when the head moves forward of the shoulder into a flexed position. We refer to this as a head forward posture, and when that happens, it throws the rest of the body's posture off as the body attempts to compensate for that particular fault. So when looking at the front picture, we might see one shoulder or hip slightly higher than the other, or maybe a tilt or rotation of the head. A lot of what we are looking for from the front is symmetry from left to right. Misalignments from the front can give us an idea of abnormal muscle tension in the neck and shoulders or the low back and hip muscles. Some of these postural faults might include or might be caused by excessively looking down at a smartphone, sitting too much at a desk, especially at a computer, obesity, habitually standing cockeyed or carrying something heavy on one side of your body like a purse or a backpack. So whatever the cause, if you want to avoid the health problems that I discussed earlier in this video, then you have to do something about it. And you have to do something about it earlier in life before a lot of damage occurs. But what do you do? Well, when you come into our office, we take a 2-pronged approach to improving and then maintaining your posture. Of course, we start with an evaluation, which includes the digital postural assessment that I talked about earlier. And then also we perform a movement assessment of your neck, shoulders, back, and hips to determine if you are moving properly, which goes along with posture. And then we check for subluxations or kinks in your spine, which are most likely causing both the posture and the movement faults. If we think that we can help you, we will discuss care options at that time, and we'll go from there, of course. The bottom line is this: it's becoming increasingly obvious that posture and having an optimally functioning spine is vital to good health and overall vitality. So maybe you should at least have yours checked to see how you're doing, don't you think? So look, call our office at 417-598-0080, and for only $19, we'll perform a complete consultation and examination. Excuse me. We will perform a digital posture assessment, a movement assessment of your neck, back, shoulders, and hips, and we will check for the presence of subluxations or kinks in your spine. Again, give us a call at 417-598-0080. All right, that's all I have for you today. Thanks, and have a great day. We'll see you soon.